Hey everyone, my name's Isaac, and today I'm going to be talking about health literacy and safe discharge in emergency care. The first thing that we think of when we think of health literacy is often the ability to understand healthcare terms or ideas such as blood pressure or the names of different medications. Over the years, the definition of health literacy has expanded to not just include understanding information, but also knowing how to use that information. Health literacy also includes knowing what resources are available and knowing how to find resources for different things. It can also impact a patient's ability to communicate symptoms, for example, different ways to describe pain or describe what their experience is. The difference in information that the care team gets when a patient says, "My arm hurts," versus "There's a radiating pain going up my arm into my shoulder." Those are two very different things. Knowing how to communicate those kinds of things to your care team is an aspect of health literacy as well. Here's some quick statistics about health literacy. This is from one of the most thorough studies on literacy and competencies in American adults, and it's from 2003. So not that recent, but it is one of the most comprehensive studies with over 19,000 participants, and they determined that only 12% of adults were considered proficient in health literacy. While a patient's health literacy ability is very individual, there are some risk factors that can indicate maybe more of a risk of having a low health literacy. That can include being older or having a lack of education. In this study, they found that a patient's ability to understand health topics went down the less education they had, with around 50% of people who had not graduated high school having low or below average health literacy rates. And disparities are also exacerbated in minority groups and low socioeconomic status groups. Understanding and implementing healthcare knowledge and health literacy is very important because it increases patient inclusion in care. When a patient understands what's happening, then they can definitely be involved more, they can be more involved in their decisions, and they can feel more of a sense of autonomy. It can also lead to improved health outcomes, not just because the patient is involved in their care, but also because they might be able to identify symptoms that are worrisome at home. If we're educating our patients properly about side effects of medications or times to notify their provider, then that can reduce the possibility of them having a return trip to the hospital or further issues in the future. And it also leads to safer discharges because the patients will understand the medications that they're taking, understand how to take them, and then understand any different care instructions that they need to be sent home with, etc. Healthy People 2030, which is a project of the Office of Disease Prevention and Health Promotion, has a couple of goals for the country that relate to health literacy and communication in healthcare. These are two that I wanted to highlight. The first goal is to increase the proportion of adults whose healthcare provider checked their understanding, and the second one is to increase the proportion of adults whose healthcare providers involved them in decisions as much as they wanted. The first tool that I want to talk about today is the Rapid Estimate of Adult Literacy in Medicine short form quiz. This is a very quick quiz that you can do with a patient just to kind of get a general idea of their healthcare literacy level. This is the form right here. It'll only take a minute or two to go over with a patient, and it gives you a general idea of what sort of medical terms they might understand. So when you have this form, you just sit down with a patient and you go through each one of these words and you ask them to explain what it means, and you only give them about 5 seconds. So if you say exercise, what does exercise mean? Give them a couple seconds to think about it, and if they don't immediately have an answer, then move on to the next one. Be polite about it, obviously, but you want to see how many of these example words they understand, and then that can it gives you a score, and based on that score, you can plan your communication and plan what sort of brochures you want to give them. And this form is free, and it's available on the Agency for Healthcare Research and Quality website. They also have longer versions of this form available. This is the quickest one, but they also have versions available in Spanish, and they have some that have 50 questions, so it's a little bit more in-depth. In an emergency room setting, there's probably not a lot of time to do a 50-question questionnaire, so this is a really quick one, and I think it could be really helpful. This second tool is something that I'm sure we've all heard. We've talked about it in classes before, but I think it is a good reminder, and that is the teach back method. after you explain something, how to take a medication or what an illness means, something like that, ask a patient to explain back to you what they learned. And I think it's important to remember that this isn't testing the patient's memory. You're not testing, their thinking or anything like that. It's more of seeing how well you taught it and how much they were able to understand it. And I think it's really important to remember not to be patronizing and remember that a lot of these concepts that might seem simple to us as nursing students can seem really overwhelming or confusing to people who aren't in healthcare. So just simple questions like, can you explain to me what you learned from that? Or what do you need to know about this disease? Or something like that. A really simple question. Try to get them to explain back to you what you taught them. So this is not just figuring out what they learned from it, but also you're using it to analyze your own teaching skills. This third tool is a little bit more general, and it's not just individual to each nurse, but it's also as a facility or as a team, and it's using patient feedback to improve. Hearing from the patients themselves how their experience is going and what makes sense to them and what they didn't understand in their visit is one of the best ways that we can see where our blind spots are and see where our shortcomings are when we're trying to do patient education. So here are some example questions from a patient feedback survey from the AHRQ. The first one is, thinking about your most recent visit, did people in this practice explain things in a way that was easy to understand? And then they give yes, definitely, yes, somewhat, or no. And then the other two are, thinking about your most recent visit, did people in this practice use medical words that you did not understand? Or did people in this practice talk too fast when talking to you? And using forms like this, encouraging patients to fill them out or making them easily available in the office or online is a way to get an outside picture of how people are talking to patients and what ways communication can improve. Another aspect of healthcare literacy that isn't talked about that often is the ability to communicate with your healthcare team or access information from your healthcare team, such as through an app like MyChart or through a hospital's phone services. Even though those things are so modern and it seems like apps and phones are everywhere in all of our lives, there are people who struggle with using those things, or especially older people, they might have a hard time working through a phone tree to get to their doctor or to leave a message with a primary care provider or something like that. So it's important to make sure that all of these things are easy to use and accessible. And one way to do that is to do a telephone communication assessment. And this is pretty simple. It involves someone calling a practice and kind of role playing as a patient and seeing what the experience is like calling as a patient. How long were you on hold? How many people answered the phone? Were the menus easy to understand? That sort of thing. I think one of the most important things to keep in mind when you're thinking about patients with potentially low health literacy or who struggle with communication and things like that is, what would this experience be like from the perspective of the patient? If I'm the patient and I don't understand healthcare terms or I don't understand a certain piece of technology, how easy is it going to be for me to get the information I need? And I think this is a very simple and helpful way to assess that. When we're thinking about advocating for patients who might have a low health literacy or who would struggle with understanding healthcare terms, it's important for us to make sure that they're able to play an active role in their care and to include them as much as we can. A lot of these health concepts can be very complicated and hard to understand, but I think it's important that we don't avoid talking about them just because we're worried that the patient might not understand. I think it's always better to try to explain something and then fail than it is to assume they won't understand it so you don't try. So I think we should do our best to encourage patients to ask questions, encourage them to speak up if they're confused, and also just keep in mind that a patient does have the right to see their medical documents if they're requested. And I think a lot of people don't even know that they can go on, to a MyChart or something like that and see their medical information. A really great resource about health literacy is this AHRQ, that's the Agency for Healthcare Research and Quality, Health Literacy Universal Precautions Toolkit. And this is a very helpful resource. It's free to read online, and I would definitely recommend checking it out if you have any questions. And here are my references. Thank you so much.